today we have a third year BME students with us. They are going to have a DT based activity video which is debate on topic called ultrasonic diathermy. So let's see the discussion now. So we will have a formal introduction, then we will go with DT based activity video. Yes, you can introduce yourself.
So myself Shrutika from third year biomedical engineering.
So myself Diksha from third year biomedical engineering.
And myself Prakshita and from third year biomedical engineering.
I'm Kavya from third year biomedical engineering.
So we both gonna have a debate on the positive sides of the ultrasonic diathermy.
And we both going on the other side of this ultrasonic diathermy.
So ultrasonic diathermy is a therapeutic device which is crucially used in physiotherapy and rehabilitation. And so ultrasonic diathermy is a therapeutic device which uses high frequency sound waves to generate deep heat into the body tissue. So it is crucially used in physiotherapy and rehabilitation. It works on the principle of the conversion of sound energy into heat energy in the principle of refraction, and absorption. It is mainly used to relieve from pain, muscle spasm, and improves blood circulation and promotes tissue healing.
So apart from advantages, there are some disadvantages as well. Some of them are it cannot be used over some parts like eyes, bones, reproductive organs, and patients with metal implants. And it is also expensive when compared to traditional methods. It also may cause flames if not applied properly. It requires skilled person to handle this equipment properly. Another thing is it is not suitable for all patients. It might be a disadvantage for patients with cancer, fracture, infection, and it also affects pregnant women.
Yes, what Prakshita said is right. Is there any counterpoint for Prakshita?
So I would like to share some advantages of ultrasonic diathermy. The first one is deep tissue penetration, and second one is non-invasive and painless method, and third one is it increases blood flow to recover pain, and fourth one is reduces pain and stiffness of joints and muscles. So these are the advantages of ultrasonic diathermy.
Yes, I agree this point, but there is some disadvantages like high cost and making a risk of burns and tissue damage is also causing. And I can ask some queries and questions. Queries is which depends on the burning of tissues, which and also using a large area as compared to the other diathermy like short wave or ultra microwave. It uses in large area and not going with deep penetration. But this ultrasonic can move with small area but deep penetration. What it make tissue damage? What do you think about this?
So what actually the Kavya is asking in the sense, how about tissue damage in case of ultrasonic diathermy? Because in other conventional techniques like shortwave diathermy and microwave diathermy, there also we have a same principle, which is the heating principle. There also we are sending the waveforms. But what is the main advantage of ultrasonic diathermy is there we have a deep penetration compared to other things. So here comes the question, how about the tissue damage when we have a long penetration? That is actually the Kavyas are raising the question. So do you have anybody who would like to answer for this question? Do you have any counterpoint for this?
So here we use both thermal and non-thermal effect, which is continuous and pulse mode, depending on the thing. So it will thermal and non-thermal effect, which is continuous and pulse mode, depending on the pain. So here it will provide patient comfort and prevent tissue damage.
Well said, Suprika. So now I would like to have anyone to conclude this debate by giving summary of this topic.
Yes, we conclude this debate with using of ultrasonic diathermy, both as compared with both other diathermy is also useful for many patients like for sportsman injuries and muscle skeletal disorders, etc. And we using this ultrasonic diathermy, expert supervisors and well-grounded and isolated circuit we used. There is also no disadvantages happen in this diathermy. Thank you.
Yes, thank you. I think now you might get a great knowledge on this particular topic. We get to know what is the pros and cons of this ultrasonic diathermy. I hope so that you like this video. Thank you.